Okay, so we're doing what we refer to as a series of snippets on a variety of topics that Dr. Gates and I treat, and we're sharing our experiences and our understandings with you. I am Dr. Martin Rutherford. I am a certified functional medicine practitioner.
Dr. Randall Gates, I am a board-certified chiropractic neurologist.
And one of the largest aspects of our practice is peripheral neuropathy. We just, the whole practice has kind of evolved and continues to evolve, as we're finding out from what we were just talking about, continues to evolve into more and more conditions that respond to our combined methods, our combined disciplines. But we consistently get a lot of peripheral neuropathy patients in here. We are in the process of doing our final writing and editing, collaborating on a book on peripheral neuropathy and the 80-some potential causes that can cause peripheral neuropathy. So today we're going to cover sciatic neuropathy.
Mm-hmm.
It's in the literature. People come in, we do evaluations, and we do consults before we ever treat anybody. And people come in with the diagnosis of sciatic neuropathy. So we thought we'd like to clear up a few things on that we become aware of, that people come in with certain concepts that may or may not be accurate with this. So
absolutely.
I'm going to defer over to Dr. Gates on this. He's done the lion's share of the investigation on these and most of the examinations and evaluations. So why don't you share with these folks, what your understanding is, and what you want to bring their understanding to them as to what sciatic neuropathy is.
Absolutely, because we have a website going up called peripheralneuropathygroup.com where
it's up, isn't it?
It's up, and we're taking all of our videos. I don't know how many we have. We must have 30 plus videos on all the different types of neuropathy. And peripheral neuropathy in the lay language really refers to when somebody gets numbness, tingling, and or burning under weakness or cramping, mainly in their feet, can progress up to their knees, and then can involve their hands. There are variations on that we won't get into. However, in evaluating so many patients with peripheral neuropathy, lots of times people come in thinking they have peripheral neuropathy, and they really don't. They have something like sciatic neuropathy. Sciatic neuropathy refers to the sciatic nerve. Now, the sciatic nerve is a very specific nerve. It's very large. It's almost as thick as your spinal cord when you look at it under an anatomy dissection. And it runs through the buttock area, down the back of the thigh, and then it splits into two separate nerves. One is called the peroneal nerve, and it goes over the front part of your shin, and the other one is called the tibial nerve, and it runs down underneath your calf muscle. And basically, patients who get a sciatic neuropathy, it's oftentimes due to hip surgeries. Sometimes it can be due to people getting injections in their butt for things like steroids that we just talked about, where the injection is misplaced and the needle actually hits the nerve. It can be due to things like endometriosis, where a woman has basically uterine tissue growing throughout her abdomen, but it can spread down into the gluteal area and get provoked by her menses. So a variety of things of that nature, or dislocations of the hip, fractures of the hip can cause the sciatic nerve damage there. But that, in essence, is sciatic neuropathy. We had a very interesting case where a young lady was a basketball player, went in for a knee surgery, and during the knee surgery, they actually clamped down on her sciatic nerve so hard in order to prevent, basically blood loss, that her sciatic nerve got damaged, and she developed something called reflex sympathetic dystrophy, or complex regional pain syndrome, which is where, because you have a nerve injury, you get this fight-flight mechanism in the nerve that causes less blood flow to go to the extremity, and they get horrible pain. And it is talked about in the sciatic nerve.
And they're told nothing can be done.
And lots of times they end up disabled. For the rest of their life. Luckily, this little girl had a great comeback. She ended up playing basketball again this season. It was pretty neat. But nonetheless, reflex sympathetic dystrophy can go along pretty frequently or semi-frequently with sciatic neuropathy. Now, any patient who thinks they have a sciatic neuropathy, they have to be differentially diagnosed for a low back lesion. We're obviously very well versed in that.
Well, we didn't mention that we're chiropractors. I'm a chiropractor, 36 years. We're chiropractors who practice also with other certifications and other board certifications. So.
Yeah, exactly. And so basically we have a lot of training, obviously, in spinal disorders and, in essence, back nerve lesions due to arthritis, due to disc herniations have to be differentially diagnosed, and that can be done basically via the exam or imaging. like MRIs and CTs and X-rays can help with that whole process. So that's what we would say on sciatic neuropathy. I don't know if you had anything else that you wanted to
Usually
add.
it's one side.
Usually it's one side.
It's a kind of a pseudo-neuropathy.
It is a
Kind of
pseudo-neuropathy.
so we, in a book, we try to differentiate true neuropathies. True neuropathies are usually going to be both feet. They're going to be differentially diagnosed. Frankly, you can differentially diagnose them pretty well with a good neuro exam, which most people don't get because people just tend to go right to the nerve conduction velocities and so on and so on. But it's usually going to be on one side, and you're usually going to be able to trace it to some sort of an event. You're going to trace it to your buttocks or your back or something like that.
Yeah.
It's not really truly a peripheral neuropathy, and generally the cause is I won't say easy to find out, but the cause is discernible.
It's very discernible.
And then you have to go after that. So.
And there, for all of our neurology friends out there, we'll be a little more specific. So as we mentioned, peripheral neuropathy in the lay language refers to the numbness and tingling in both feet, burning pain, so on and so forth. Really, peripheral neuropathy is technically termed distal symmetric polyneuropathy, meaning there's many nerves involved, and that's why you get both feet. Technically, peripheral neuropathy means when you have a peripheral nerve lesion. So sciatic neuropathy is actually peripheral neuropathy, but it doesn't fit with how most of you out there are going to know peripheral neuropathy. And if you're not confused, then I'm impressed.
I was just going to say, and I could take the next 5 minutes to explain that, but I'm not going to.
But we have it on record.
The bottom line is usually on one side, and it's not usually on both sides. So you're not the classic peripheral neuropathy of, oh, it's your blood sugar, or it could be your back, but they'll oftentimes say it's your blood sugar, it's your back, it's your ankles, or it's your neck. And this doesn't exactly fall into that category of peripheral neuropathy. So I think that's a question that I usually get. Well, how come? He said it was my blood sugar, and I'm like, well, it's only one leg. It was your blood sugar, it'd be both your feet, and so on and so forth. So, all right. So hopefully that's helpful. Sciatic neuropathy. Have any questions? You can refer to the website that Dr. Gates referred to, our
peripheralneuropathygroup.com.
Group.
Our book should be coming up soon in the next few months, so you can get a copy of that, and that will fully explain what I just mentioned.
Okay.
And or you can send questions to powerhealthtalk.com as well as our Facebook page, Power Health. Thank you for watching.
You're welcome.